Welcome to another episode of Healthcare Matters. As we mark the World Sight Day on the 12th of October, today we delve deep into the topic of vision health. With an ever-growing global concern, vision health impairment impact not only individuals but society as a whole. Did you know, for instance, that by 2050, more than the global population will suffer from vision impairment? Today we are honored to have an expert in the face of Professor Hristina Grupcheva. She will shed the light on the complex realm of vision health. Together, we will explore the challenges, we'll delve into the statistics, and discuss the tangible solutions. With the growing challenge on vision health, the topic can't be more timely or relevant. Thank you so much, Professor, for joining us. Let me start by asking you, how are you today?
Thank you very much for inviting me. I'm great. I just came from Romania. Actually, in Sinaia, there was the National Romanian Society of Ophthalmology Congress. And it was a great opportunity to share with my colleagues from Romania, which are actually 6 times more than the colleagues in Bulgaria, knowledge about a variety of different subjects related to vision.
Thank you and welcome back. And we know that you are a professor, an esteemed ophthalmologist, but we know that we have a talent and passion for writing. Would you tell us more about your amazing book, 55 Reasons to Love Your Eyes?
Well, I have more than 20 books, but this one is the most interesting one because for a long time I wanted to write a book for the general public. So basically, I worked a lot, more than 30 years in the field of vision. I did lots of projects, and that was in my mind, I should say, for the last 5, 6, maybe even 10 years. I was writing chapters, I was writing papers, I was thinking, okay, what to do. And this year, I actually turned 55. And I said, okay, I should make 55 reasons why to love the eyes. So that is how the title came. It has different chapters, the book, and it's directed to health and prevention of eyesight loss. So basically the main idea is that people understand that the sight is forgiven, but we need to take care of it because this is the most important thing.
So happy 55th anniversary, and what a great way and legacy to celebrate such a special occasion. As you know, October marks the World Sight Day. If we speak specifically about the challenges face individuals with vision impairment or vision loss in Bulgaria, could you tell us more about that?
Well, basically, my mission in life is to provide vision for everybody from 0 to 100. And this is extremely difficult because you have different kind of people, you have different environments, you have different social status, you have different understanding about treasure in life. And sight is definitely one of the treasures because if you lose sight, you understand it, but before that, many people just do not even think about it. Many people just say, okay, I need to go to an eye doctor, but maybe tomorrow, maybe in 5 days, maybe in 10 days, maybe in 5 years. I have lots of patients that are coming to see me in 5 years' time and they say, I was here last year. People just do not pay attention to prophylaxis. If they have no problems, or think that they have no problems. I think that the biggest problem in Bulgaria is undercorrected refractive errors, like in any part of the world. And that, of course, includes any age. And people just postpone it because this is not painful, this is just a little bit of discomfort. It's easy to make bigger the print of your mobile, and that's it. But we have some serious diseases as well. Cataract is not an issue anymore because we have very good opportunities to operate cataract in Bulgaria. But glaucoma, macular degeneration, and interestingly complications from systemic disease, and the first one of course is diabetes. In Bulgaria, lots of people are with uncontrolled diabetes, and uncontrolled means that they even have no knowledge how to manage and control their dreadful disease. So I think that this is the big problem in Bulgaria. And this mindset about prophylaxis, I think that we are still at lower level in comparison to other European countries.
Very good. So some of those challenges are very Bulgarian specific, but some of them also are on global level. And that might take me to my next question related to the 2021 resolution from the United Nations General Assembly, Vision for Everyone. What would be your reflections on the global response on the efforts to address this challenge?
Well, interestingly, when Vision 2020 came, I was firmly believing that till year 2020, we are not going to have people with visual problems and people that are getting blind from preventable blindness. Unfortunately, this was not the case. So this new slogan, Vision for Everyone, I actually like more, because this slogan implies that everyone should also participate in the process. It's not that the society or the governments or some organizations or the eye doctors are providing. Vision for Everyone actually includes the vice versa, so the person needs to participate in this practice as well. So every person must be aware that for their vision, they also need to make an effort to care. And Vision for Everyone is a very good initiative. I hope that everybody will take it seriously, because vision today, without vision, I think is very difficult to experience the world. And yes, there are some unfortunate people, and they find the internal power to appreciate the world from their own perspective. But generally, it is a real suffer for people that have a secondary visual loss. So people that had normal vision, and because of ignorance, they are not having so good vision anymore. For them, adapting to the world is extremely difficult. And if they can prevent it, this is the best favor that they can do to themselves. So in my opinion, Vision for Everyone is an initiative that should include the whole society.
Very good. I like very much how you highlighted the importance of collaboration, partnership, diversity of stakeholders who need to collaborate to make this slogan a reality. And that will take me to my next question, where you mentioned earlier diseases like age-related macular degeneration, other diseases like diabetes, macular edema. They really represent a huge burden on the economy of a country like Bulgaria. What would be your recommendation for some sustainable strategy to address this in our country?
Well, it is very difficult because there are two completely different diseases. First of all, macular degeneration is an aging phenomenon, and unfortunately we can treat it, we can try to prevent it, we can try to manage it, because prevention is not really possible in this case because it's a progressive disease, but it is inevitable because people are getting older and older, and we try to make this getting old sustainable. So that means that we are going to face more and more of this disease in our everyday practice. So for macular degeneration, I would probably advise, if possible, to make a strong prophylactic program where we can put those people that are with initial macular degeneration, follow them up and treat them properly, and have a strong criteria for treatment, and also get those people involved, because it is very difficult for a person which is out of their social life anymore, and some of them are even have no support even from the family, because family is overseas or family does not pay enough attention to them. So maybe in this case patient organizational groups may help a lot, because those people are somehow isolated. And I have very many examples from my own practice, like old teachers and old clerks and old people that were always doing a special job related to their eyesight, and now they cannot even read a book. And this is a disaster for them, and many of them are depressed as well. So I think that this support and psychological help is very important for them as well. On the other side, diabetic retinopathy. Bulgaria is somehow a leader in having complications from diabetes, and diabetic retinopathy in Bulgaria is very often. If you have patient with uncontrolled diabetes, of course you expect to see some complications into the eye. And unfortunately the control of our patients is not so good, and that's why we are having this not favorable position for eye health in Europe, because we have lots of patients with macular edema, with proliferative diabetic retinopathy. And for me it's a real pain when I ask a patient, what is your glycated hemoglobin? And the patient answers, what is this? Because they really have no good control. And they really have no idea what the markers of good control are. Maybe they have some glucometers at the house and they can check their blood sugar, but they have no idea that this needs to be sustainable. They have no idea that blood sugar of 10 is not good, and they have no idea that they need to observe their diet, their lifestyle, their sport activities and physical activities, and everything related to their disease. So that's why we have so many complications. And those people are actually also a huge economical burden, because some of them are losing their profession. And this is not only because of the eye complications, this is because of their general status, this is because of either other microvascular complications. And what we need to do is to work together with endocrinologists and other specialists. And I think that here, not only ophthalmology, integrated care is the key in this particular case.
Very good and very valuable insights. That will take me to the next question. So how can our society play a more active role in supporting those individuals with vision impairment or vision loss?
Well, I guess that society is a very general term. We need to collaborate between the medical specialists, patients' organizations, and of course industry. Because I always say that regardless how good our knowledge are, without industry we cannot do anything, because industry provides us with the instruments, with the medications, with the algorithms which we can use in order to treat better and better our patients. On the other hand, whatever we have as instruments and knowledge, if we have no patients to hear us, to come to us and to follow our advice, this is also not possible. So patients' organizations should play a key role here to inform people, and everybody together should make enough activities in order to popularize, first of all, prophylaxis and prevention, and after that, the possibilities for contemporary treatments. And finally, the role of the government, of course, because many of those people cannot afford expensive treatment, and should be a way that those people have accessibility. And currently in Bulgaria, actually, the healthcare system has quite a lot of problems because it's quite rigid. And because of this rigidity, it takes a long time until something like innovative therapy is approved. So I think that there is a lot of work to be done. and probably the role of the societies like the Society of Endocrinologists, the Society of Bulgarian Medical Specialists, Bulgarian Society of Ophthalmology as well, should be also key in those initiatives.
So I appreciated how you reflected on the value of partnership and collaboration. And that will take me to the next question, because we believe also that partnership is instrumental in driving really better outcomes for our patients. So some of the key stakeholders you highlighted, definitely ophthalmologists, non-governmental organizations like patients' organization, and policymakers. If you have a piece of advice or a message for each of those, to an ophthalmology colleague, to a patient organization, to a policymaker, what would it be?
Well, to my colleagues, I probably would advise to be always on the top of the iceberg and know almost everything which is new, because everything new is not possible to know, but at least in their particular subspecialty, and to try to implement it regardless of the difficulties. So new technologies, new treatments, innovative approach, and personalized patient's care. To the non-governmental organization, basically I would advise them to involve us in their activities, because this is a bilateral process and we may help with advice, with expertise, and to try to involve as many people as possible, because I know that this is very difficult and that not everybody is happy to declare that they have a problem and they want to be a member of organization, but with a little bit more work this is possible. To government, definitely involve specialty eye doctors into their working groups. What I mean that they need to involve people from the practice, because theoretical ophthalmology is not working for making policies. You need to have somebody who every day sees patients, you need to have somebody who every day sees difficulties and know exactly what the problem of the current policy is. Because if you look just from a side, what is written and what could be done is completely different than to look from everyday practice and see the concrete obstacles and probably advise on very special small steps that may make the patient journey easier, because there are always problems which make patients decide, I'm not going this way. And this is a disaster, because basically they refuse to have treatment. So very important is for policymakers to have people from the field.
Thanks so much, Professor. Do you have any questions for myself?
Of course I have questions for yourself. I know that originally you're from Egypt and you worked in Lebanon, and after that you came to Europe. And my question is, what makes you stay in Bulgaria?
So actually, Bulgaria is very interesting first in terms of history. Bulgaria has a great history, a great culture, but I believe specifically for the challenges of the healthcare system and the challenges of our patients are facing today. You mentioned awareness and education, prophylaxis. You mentioned a need to work more on the diagnosis, how we can help in terms of treatment, outcome tracking, how we can help our healthcare system to be more sustainable. That really inspires me and drives me, and I see a very high level of collaboration and partnership and willingness to provide better care for our patients here in Bulgaria.
Okay, that is a great dedication, and I really wish you good luck, because this is important European-wide. We have no borders for many things, but we do experience problems when patient was treated somewhere and after that they come to Bulgaria, or they were treated in Bulgaria and after that they go to another system. So I think that people like you are really in need. And finally, I have a question which is very concrete. For the year 2024, what are your plans for partnership with maybe Bulgarian Society of Ophthalmology or maybe patients' organizations or maybe something together?
Thank you, Professor. So in general, we believe that the foundation to build this partnership first is deep understanding of the challenges our patients are going through in Bulgaria. And the second one, really attentive listening to the feedback, to the proposal and the way forward. And we try to focus our energy in three pathways. The first one is the patients, our ophthalmology patients, and we are very much determined to help more in terms of prophylaxis, in terms of education, even working with the patient groups in terms of capacity building, capabilities building. The second and very critical pathway is the collaboration with the ophthalmologists and the ophthalmology societies. And again, we see that it will be big value in supporting and collaborating in terms of education. For example, the university in Varna is very active in terms of education for both, the postgraduate and pre-graduate, our future physicians. And we would like to do more and to collaborate and to empower even our ophthalmologists and make sure they have a very good experience. And the last and final pathway is the collaboration with the healthcare system, with the policy makers. How we make sure that ophthalmology and vision health is a national priority. How we make sure that our healthcare system in Bulgaria is more ready for future and current challenges. How we can make sure that vision health is part of our 2030 digital health strategy, for example, in Bulgaria. We are also having a lot of focus and energy to collaborate with those three pathways, either the patients, the ophthalmologists and the societies, and finally the healthcare system and the policymakers.
Okay, thank you very much. Listening to you, I actually have an idea that we should make a book together called 150 Steps to Make the Vision of Bulgarians Better.
That would be an honor and a pleasure, and I would be very, very happy to be co-author with you in one of the books. Yeah.
I have another question for you. In your opinion, what is the key point for partnership between companies, industry, and ophthalmologists all over the world, and particularly in Bulgaria?
I believe the starting point is to discuss the shared vision and goals, making sure that the partners have a clear vision and goals. What needs to be achieved? You mentioned number of time prophylaxis, you mentioned some economical challenges, need for education and the awareness. So the clarity on what needs to be done exactly. And then the second point would be really a close collaboration. That include thinking about pragmatic solution and utilizing innovation, for example, utilizing technology. And definitely to have this close collaboration, you will need trust, you will need respect, you will need open communication. The third point is to really respect all local laws and regulation, respect our patients' safety, our patients' privacy. Very important because healthcare in general is very sensitive. And finally is the agility. We have learned a lot from COVID-19, for example, in the past years where it was a shock for everyone in the healthcare sector. And we believe that healthcare in general is very dynamic and it needs a lot of agility, a lot of discussion about what we have learned from the past. What can we do different in the future? So if we combine those together, a shared vision and goal, closed collaboration that include technology and the innovation, really respecting all local laws and regulation and have agility, I believe we will have a fruitful partnership and collaboration.
Okay, and I have a very personal question to you. Forget about your position. And as a person, how often do you go to an eye doctor?
That's a very challenging question. And in reality, I realize now that I don't go quite often. So the last time, for example, it was 2 years ago. And it was to change or to check the quality of the eyeglasses itself. But I realize now that we need to start with ourselves and to go more often and to visit our ophthalmologist.
Yeah, so the most important thing to remember is before age of 18, everybody should go every year. And after that, if you have no problems, you may go between 18 and 40 every 2 years. But after 40, everybody should go to an eye doctor. And basically, today we have fantastic technology. Even without pupil dilation, we can do a scan of the back of the eye. We can see very small changes, very subtle initial signs of disease. And this is absolutely painless. So eye examination is very nice and very painless examination without too much discomfort for the patient. And there is no reason to be skipped from emotional point of view and from psychological point of view. So the only thing is that we need to put it on our agenda and see our eye doctor regardless with or without complaints.
Thank you. This is very valuable advice. And as we are approaching the end of our episode, do you have any take-home message or final remarks from today?
Of course, I have lots of take-home messages, but if I want to put it like in 1 or 2 sentences, the most important thing is that everybody really treasures their vision. And people that are in a position to change things, like the industry, the eye doctors, and the governmental institution, they should treasure the vision of everyone, because this is their obligation. And everyone themselves should help themselves to see better all the time. So basically, this is the way that we can go to a good vision for everybody.
Thank you very much, Professor. And we really look forward to continue our valuable discussions and to see vision for everyone, because healthcare matters.